Anemia is the condition when your oxygen is depleted because you are not carrying enough oxygen in your bloodstream. This can present from hardly any symptoms to symptoms that are almost overwhelming. So your red blood cells are not carrying enough oxygen. You may think of this as equivalent to if your lungs were not oxygenating, or if you took the oxygenated blood to tissues, the blood vessels were not allowing blood to move into the target organ, like muscles. Each organ system doesn't work as well. The most common parameter we define for stating when a person does not have the capacity to carry oxygen in their blood, or anemia, is the H&H, or hemoglobin hematocrit. Hemoglobin is the amount of red blood cells in your bloodstream, and the hematocrit is the percentage of red blood cells in the blood. You will feel lethargy, and perhaps when we when we can correct these problems, you'll feel much more in tune. Occasionally a person loses red blood cells gradually over time, and they accommodate for this lower oxygen carrying capacity. There are many causes of anemia, including a shortage of iron. When a person has a shortage of iron, it may be due to poor iron intake, not being able to bind iron and absorb it. This can be from a B12 deficiency. It can be from other problems. A person may also lose blood, and therefore through their intestine or their urine, and therefore deplete their iron this way. Disruption of production of red blood cells is another cause of anemia. This usually does not necessarily go with iron deficiency. So there are a large number of reasons, a large number of ways a person can become anemic, and the analysis may take several visits. Hopefully, if it's simple, we'll get there right away. Individuals with other diseases, such as ischemia or lack of oxygen to the heart muscle from narrowed heart coronary arteries, for instance, or lack of oxygen flowing to the kidneys, or diminished capacity of any tissue, will be at risk when they're anemic, and including serious risk. There are about 120 days in the lifespan of a red blood cell. In approximately 7 days, the red blood cell starts in the bone marrow to becomes mature enough to enter the circulation. Approximately 1% of red blood cells in the circulation represent cell leaving the bone marrow in a particular way we can see, called reticulocytes. So in the event that there's been loss of or sequestration of red blood cells in the system, there will be an increased number of reticulocytes in the blood. Reticulocytes are one things we look for. We'll also check for iron content in the blood, for vitamin B12 and folate, and other factors. Red blood cell shape influences their ability to carry oxygen, and in certain anemias like sickle cell anemia or thalassemias, there will be an altering of shape. Not all hemoglobin is created equal. There's some genetic variation. I mentioned sickle cell, which generally an individual knows about, but they may just be a carrier of a sickle cell trait. Thalassemias are a group of genetically inherited diseases that have altered hemoglobin structure. There are many of these, but some of them, most of them, that people live with, they experience minor changes in their capacity to do things. Poor iron intake can be one of the reasons why a person's anemic. A diet high in phytic acid, particularly on the world scene where people don't have enough oil or petroleum to heat their beans sufficiently, the beans can contain phytic acid that's not denatured. Phytic acid will bind iron and zinc and calcium. Deficiency of certain vitamins, particularly vegetarians. If they're pure vegetarian, they don't have vitamin B12, which is essential. There's also an autoimmune deficiency disease related to low B12s. Gastrointestinal toxins such as lead and alcohol frequently will cause an anemia. Initial tests include iron, a CBC or complete blood count, and this has a red blood cell count in it with multiple parameters. Particularly the MCV, or mean corpuscular volume, is an indicator of red blood cell size. With a low hematocrit, low MCV, and a high RDW, which is a measure of the relative distribution of sizes of cells, this suggests a chronic iron deficiency. Reticulocyte counts, as I said, these are the immature early red blood cells, and there'll be higher percentage if a person's losing blood. The comprehensive metabolic panel will include a look at your liver functions and kidney functions to assess whether they're contributory to the problem. Thyroid functions are often needed, as hypothyroidism will result in some anemia frequently. Colonoscopy may be appropriate if we suspect that there may be any loss of blood in the colon from any reasons, particularly inflammatory bowel disease such as Crohn's disease or ulcerative colitis, possibly cancers, possibly arteriovenous malformations. Other problems cause this. Additional blood tests may be needed following our initial blood tests. These include an ESR or erythrocyte sedimentation rate to look at general inflammatory processes, and sometimes immunoglobulins to help understand. The iron status can be better evaluated by looking at the iron stores in the transferrin and ferritin levels and the vitamin B12, as I mentioned, and folate levels. Hemoglobin electrophoresis, or looking at the specific migration of hemoglobin over an electric field, reflects the structural changes in them, is pretty much reserved for understanding the thalassemias and sickle cell if we suspect it. Additional tests, physical exam looking at the cervix, ultrasound looking at the uterus to see if there are fibroid tumors contributing to loss of blood. Sometimes an ulcer, an H. pylori test can help us understand if an ulcer is present. Ulcers cause blood loss. As I mentioned, the colonoscopy. Blood loss from the nose or epistaxis is not uncommon, and usually a patient understands this quite before they show up. Disruption of the small intestine from the surface of the small intestine from celiac disease, which is a severe gluten intolerance, not to be confused with most people having some mild gluten intolerance over extended exposure to it. If there is poor red blood cell production, then we'll need probably a biopsy of the bone marrow from the hip bone. This is not common that we need it, but if it is, it's not a particularly trying thing to do. There can be a myeloproliferative disorder, a slow progression of cells, or cancer, and sometimes one will move into the other. Some genetic causes, the hemoglobinopathies, as we mentioned, also glucose 6-phosphate dehydrogenase deficiency, a very long name, but most people know about this in their family, or they'll present with some episode of weakness, or they have some hemolysis or destruction of red blood cells, maybe dark colored urine that's not appropriate or something like this. We'll pick it up in another way. If there's a family history suspicious of odd occurrences, I may look for it now. Also, hereditary spherocytosis, we could pick up on a smear of a blood cell count, which sometimes happens. In conclusion, we've recognized that you have anemia or not enough oxygen carrying capacity in your bloodstream. There are certain tests that we've outlined that are very important to do, and because of the complexity of this, I generally recommend people come in to discuss the lab results. Clearly, when we treat anemia, you will feel better. That's one reason to do it, to treat it. The other reason is there may be an underlying disease that's important to discover and manage.